COVID-19 has had a profound effect on California's population and healthcare system since the state's first case was detected in March of 2020. Efforts to prevent new infections and mitigate the effects must continue. California's response to the pandemic thus far has been robust and multidisciplinary, and many of the efforts should be continued or emulated going forward. The state of California made a concerted effort to accurately track epidemiological data pertaining to COVID-19. A state dashboard continues to be updated weekly. 7-day rates published on November 10th of 2023 report a 6.9% test positivity rate and 233 COVID-19 related hospital admissions per day. Over 12 million cases have been confirmed statewide and over 200 million tests administered since the beginning of the pandemic. Approximately 75% of the 40 million Californians eligible to be vaccinated have received the complete primary series. Rates for subsequent vaccinations are much lower at 44 and 20% for the first booster and bivalent booster. Finally, the state reports 104,000 total deaths attributable to COVID-19.
After the first COVID-19 related death, Governor Newsom tried to help control the spread of the virus by declaring California in a state of emergency on March 4th, 2020. The strictest restriction was from March 4th, 2020 through May 7th, 2020 and decreased on May 8th, 2020. The following mandates and preventative measures were implemented to control the spread of the virus. Shelter in place stated that people must stay at home and only leave for essential activities and travel. Social distancing asked people to stay 6 feet apart in social settings, and mask mandates required people to wear masks in public areas. Governor Newsom lifted California's state of emergency to no longer be in effect as of February 28, 2023, with recommendations for social distancing, quarantining, and mask mandates still in effect for those who contracted the virus. Gaps such as inaccessibility and inequity still remain. Gaps such as lack of transportation for those who want to be vaccinated and testing inaccessibility remain. Low-income minorities have a stronger negative impact from COVID-19 due to unemployment levels, lack of health insurance, and living in high-exposure neighborhoods. Studies have shown that Latino populations in California have persistently higher exposure to risk of contracting the virus, have lower testing rates, along with higher test positivity and rates of cases. Areas with these negative outcomes are particularly concentrated, and interventions need to be prioritized accordingly.
The U.S. Congress authorized the CARES Act, which included $150 billion to address the COVID-19 pandemic within America. The resources were infused into many different communities throughout the state of California, and depending on the communities, some may have received more resources than others to ensure that equitable COVID-19 interventions applied to all of the communities. Again, as a reminder, what may have worked for one community could be completely different for another community, and a different approach and intervention may have been more appropriate. One novel initiative that was used to combat COVID-19 was the Return to Learn program at UC San Diego. The university placed these vending machines throughout the campus community, and individuals were able to have access to a COVID-19 test that they would self-administer. Because the clinical laboratories that were processing all of these samples were on site, this allowed for a quick turnaround time of 1 to 2 days. Individuals were able to find out if they were positive for COVID-19 sooner than the testing that the County of San Diego was offering.
Now we will discuss technical areas.
In the fight against COVID-19, innovation is crucial. Focusing on enhancing smartphone tracking and collaborating with tech leaders like Apple ensures accurate exposure notifications. Recent observations on the Google-Apple exposure notification system underscored the need for continuous improvement in our technological approaches. The relentless pursuit of innovation, especially in refining smartphone tracking and collaborating with tech leaders, is vital for an effective response to COVID-19 challenges.
A standardized response must be part of any public health initiative. First, there must be standardized guidelines for quarantining that specify the duration and criteria for release, while also providing support and resources to those affected. Recommendations for hygiene practices are also needed, such as stating when and where to don a mask and proper hand washing techniques. There must be a readily available supply of vaccines throughout the state, and they should be available at clinics, pharmacies, and other accessible channels. COVID testing kits should also be widely available, using initiatives including drive-through clinics or over-the-counter at stores. It is also essential that testing kits are affordable to everyone or completely covered by insurance. Lastly, a statewide COVID-19 database is necessary for data management and analysis. This will help collect and analyze infection rates, vaccination coverage, and the impact of interventions.
In addressing the challenges of COVID-19, California relies on effective performance management. With community surveys, regular surveys within communities gather valuable feedback on pandemic response, ensuring a tailored approach. Employee incentives, programs, and rewards recognize the dedication of frontline workers, fostering a positive environment. Yearly reviews have structured evaluations that identify areas for improvement, adapting strategies to evolving pandemic demands. Then, with continuous optimization, commitment to program strategy and implementation improvement ensures an agile and effective response. California navigates the pandemic with resilience, adaptability, unwavering commitment to the community well-being.
Partnerships are an essential component of a public health campaign. Since many public health organizations are underfunded and understaffed, collaborating may reduce limitations posed by lack of resources and increase likelihood of success. The breadth of partnerships may vary and may involve public or private organizations, as well as multiple levels of government. California has several successful partnerships that should continue. For example, Stanford University and Santa Clara County partnered to develop novel testing methods and implement mobile vaccination clinics to underserved communities. The NIH, universities, and several community-based organizations joined in the Stop COVID-19 Alliance to tackle misinformation, increase vaccinations, and conduct COVID-19 research. The local and state governments in California, their agencies engage with federal partners at HUD to ensure accurate information is able to trickle down to local community members. Continuing these and similar partnerships is crucial to effectively handle the COVID-19 pandemic.
Creating a line of communication between public health officials and the public can strengthen the trust between the two. Holding focus groups to gather information through open-ended questions and conversations on what real people need to help improve quality of life due to COVID-19 may be beneficial. Questions can be asked regarding why people are hesitant towards interventions in place. For example, the topic can be on vaccine hesitancy, how information can be best sent out to the public, and understand how information is interpreted when providing details and advice regarding the virus. Providing ads or other forms of information for media, starting with real testimonials with real people affected negatively by COVID-19, has the possibility to reach people hesitant of following production protocols for the virus. For example, providing a story of a mother losing her immunocompromised child to COVID-19 may circulate a stronger message that we as a community need to work together to help control the spread of the virus. Expressing professionally verified COVID-19 details such as testing, vaccine information, and new strains that is easily digestible, comes in different languages through different social media platforms, can give accurate information to different minorities and spread valid information at a faster rate, and lessen overall minority distress in medical professionals. This has the potential of lessening the spread of misinformation to the public.
We aim to change legislation and amend public policies through strategic partnerships with politicians and other officials. Our most prominent official is Governor Gavin Newsom, who has a long history of being proactive against COVID-19. He appointed Thomas Arhaden as Director and State Public Health Officer. While he is not a politician, he has been vital in shaping California's COVID-19 response. State Representatives Jim Wood and Mary Waldron are on the state's health committee and are essential to overseeing public health programs and facilities. State Senators Susan Talamentes Eggman and Janet Nagin are key figures on the state's Committee on Health and are heavily influential on public health legislation. Communicating with U.S. Senators LaFonza Butler and Alex Padilla is essential on the federal level, and partnerships with members of the House of Representatives Adam Schiff, Nancy Pelosi, Juan Vargas, and Kevin McCarthy will help ensure funding, testing access, vaccination supplies, among others.